Hello, my name is Keaton Peterson. This presentation is about understanding substance use among adolescents. Substance use risk varies across stages of adolescence. In early adolescence, ages 12 to 14, increased curiosity and risk-taking may appear. Warning signs include behavioral changes, declining grades, and secrecy. In middle adolescence, peer influence becomes stronger, increasing risk. In late adolescence, increased independence may lead to continued substance use despite consequences. Substance use risk varies across different stages of adolescence. In early adolescence, ages 12 to 14, about 10 to 15% report trying alcohol or vaping. Early substance use increases the risk of developing substance use disorder by up to 4 times. Risk factors include curiosity, family substance use, and low supervision. In middle adolescence, ages 15 to 17, about 30% report alcohol use, and about 20% report cannabis use. Peer influence is the strongest predictor, along with stress and emerging mental health concerns. In late adolescence, ages 18 to 19, about 50% report alcohol use, and about 35% report cannabis use. Increased independence raises frequency, with risk factors including access, stress from work or school, and reduced parental monitoring. Across all teen age groups, individuals with depression are about 2 times more likely to misuse substances. About 60% of adolescents with substance misuse also have a mental health condition. Additional risk factors include trauma, family history, and social isolation. Substance use may lead to changes in behavior. These may include secrecy, manipulation, or breaking rules. Some individuals may show aggression or damage property. Responsibilities such as school or family roles may be neglected. Methamphetamine is a highly addictive stimulant. It increases dopamine levels in the brain and creating strong reinforcement. Short-term effects include energy, alertness, and reduced appetite. Long-term effects include weight loss, dental damage, and changes in brain function. Fentanyl is a powerful synthetic opioid. It is significantly stronger than morphine, making small amounts dangerous. Many overdose deaths involve synthetic opioids like fentanyl. Warning signs include slow breathing, unconsciousness, and changes in skin color. Fentanyl use has increased over time. It first appeared in the early 2000s and gradually increased overdose risk. Over time, it became a major contributor to overdose deaths. The current crisis continues with ongoing prevention efforts. Naloxone is a life-saving medication. It reverses opioid overdoses by blocking receptors in the brain. It can be given as a nasal spray or injection. Quick access to naloxone significantly reduces risk of death. Substance use among adolescents remains a significant concern in the United States. About 30% of teens report alcohol use, while about 20 to 22% report cannabis use. Approximately 15% report using other substances, and about 2 to 2.5% misuse opioids. Although opioid use is less common, it carries a much higher risk of overdose and serious harm. Overall, about 35 to 40% of high school students report using at least one substance. Among those who use substances, about 15 to 20% report using more than one, also known as polysubstance use. Substance use and mental health conditions often occur together. About 60% of adolescents with substance use disorder also have a mental health condition, such as depression or anxiety. Adolescents with depression are about 2 to 3 times more likely to misuse substances compared to those without mental health conditions. About 20 to 25% of adolescents experience a mental health condition each year, increasing vulnerability to substance use. Co-occurring conditions are associated with higher risk, including relapse, hospitalization, and suicide. Early identification and treatment are critical for improving outcomes. Substance use is a significant concern among adolescent mothers. Pregnant adolescents are more likely to use substances such as alcohol and cannabis compared to non-pregnant peers. Research shows that about 3 in 5 pregnant adolescents reported substance use within the past 12 months. Early adolescents, ages 12 to 14, show especially high rates of substance use and substance use disorders. Substance use often decreases during pregnancy, but may increase again after childbirth, especially during the early postpartum period. Young mothers, including adolescents, may have higher rates of substance use compared to same-aged individuals without children. These patterns are often linked to stress and adjustment to parenting responsibilities. When a parent tests positive for substance use, access to their child may be limited. This is done to protect the child's safety. Substance use may affect judgment, supervision, and caregiving ability. Families may sometimes view reduced access to a child as a punishment. However, courts and child welfare agencies use these actions as protective measures to ensure the child's immediate safety and stability. Substance use can affect judgment, supervision, and the ability to meet a child's needs. Temporary limits on access allow time for a parent to demonstrate stability and consistent caregiving. Research shows that children in stable, supervised environments have better emotional security and long-term outcomes. These measures increase the likelihood of safe reunification once recovery is established. Thank you for listening to this presentation on adolescent substance use and prevention.